My name is Juanita. I'm a dietitian and diabetes educator. And I've started a series on the 9 essential things for a person to know if they have diabetes. We're on number 4 for this. There are a lot of numbers associated with having diabetes. And so with all of these numbers these are tools and information that you can use to be in charge of how you manage your diabetes. So let's get started with number 4. We're going to break it down today as far as the blood glucose numbers. And with those, there are targets that your doc or your provider may talk with you about. You may want to ask, what are my blood glucose targets? When should I be checking my blood glucose? The American Diabetes Association has some targets. And before a meal, typically they're going to tell you 80 to 130 is the range for where the blood sugar should fall. This number is also called preprandial glucose. 2 hours after a meal, less than 180. The other name for this blood sugar check is postprandial glucose. Blood glucose checks, all they are is just information points or information gathering to make decisions with. For instance, do you need to take insulin? Do you need to eat something? Is it okay or all right to do your activity or your exercise based on what your blood glucose check is? Did the exercise or activity help to lower your blood glucose? If you were to have an A1C that is above target, the blood glucose checks can help you identify when the higher numbers are happening. There's going to be more information in another video about how to look at these blood glucose checks. You have to know how to look at that data and how to interpret the data. So becoming a detective, finding out how to look at those numbers and make decisions is very important. And so that's coming up in another video about how to look at those data points. So number 4, knowing what your targets are. So that may be a first step for you to do, is writing those in a logbook and understanding what your targets should be. I hope you have a great day.